Today on That Business Show 2.0, we'll be talking with Kristy Taylor, president of HECA Healthcare Consulting, where they specialize in healthcare training and performance consulting for the healthcare industry. And learn more throughout the discussion, HECAconsulting.com, and that's spelled H-E-K-A, HECAconsulting.com. Kristy, welcome to the program today.
Thank you so much. I'm very happy to be here.
So first off, tell me more about the mission and the vision of HECA Healthcare Consulting.
So HECA Healthcare Consulting is a 360-degree healthcare training and performance company. What makes us very unique is the fact that there are many companies in the industry that focus on developing healthcare, actually training and development programs, but there are very few, if not any, that actually focus specifically on the healthcare industry. What makes us so different is that I have a background in healthcare. All of my consultants have backgrounds in healthcare. Whenever you develop a training program, it's not simply we're going to develop this program for the purposes of training employees and hope that we get better performance outcomes. A lot of times people invest money into training programs and it's not necessarily what they need. So what my company does is that we actually take a 360 approach where we look at the root cause of the issue. And it may be a training problem or it may be some type of performance problem. And so we have specialists such as in Six Sigma Lean. We do a root cause analysis. We have performance consultants and people that we work with to really engage you. The whole premise of this is really to try to improve the quality of care that is delivered to patients by making sure that healthcare personnel are properly trained. But again, we want to make sure that before any healthcare organization invests in training, that we actually do a root cause analysis to find out the overall issue as it relates to performance.
Why the healthcare industry and not other industries? I imagine that your processes and your procedures could carry over in other industries, correct me if I'm wrong, but why healthcare?
Well, healthcare is my background. I'll tell you a little bit about what started me. How did I get here over the past few years? So healthcare is my background. I am a military veteran. I used to be a healthcare administrator. Some years ago, I work for a health insurance company, and you can see all of the issues that we're having in healthcare right now. I mean, the debate, politics around it. And while I don't necessarily get involved in the politics of it, I do understand that when there are issues at the basics of healthcare, at this very basic level, that does affect the patient. So for example, saying that someone can go into an emergency room if they don't have health insurance, well, that has trickle down effects. Most of the time, a patient will go into the emergency room just to at least get triaged, but somebody has to pay for that. So because my background is in healthcare, I have that understanding of how this process really works. But what happened some years ago, while I was working for an insurance company, my father was actually diagnosed with cancer. And he was just like any hardworking American where he paid for his insurance and he wasn't necessarily educated on how insurance works. And I think a lot of people don't understand that. And he just assumed, well, if I'm paying for it, then it's going to cover me. And because I was working in the industry at that time, I advised him more than likely it won't, because industry is, health insurance is based on risk pool. So even though you're paying $500 or $600 a month for a policy, this will probably not be covered because you don't have cancer insurance specifically, because insurance companies are going to exclude anything that's high risk. And most people don't know that. So one thing I immediately recognized is the need for educating patients, consumers. And then the other side of that is the need to educate providers, because a few years later, I had my own personal story where I was going through some health problems. I was complaining to doctors about some pain that I was having, and I was diagnosed with having fibroid tumors. And this went on for almost 2 years. And so the very day that I was going in to actually have the surgery, I remember telling my students at the time, I said, this was a Friday, I will be back next Monday, because it was supposed to be an outpatient surgery. That day when I went in to have the surgery, they cut me open to remove the tumor. And that's when they found that I actually had appendicitis. Literally almost a couple years that my appendix was so hardened. I mean, I literally, I could have gotten sicker because of what was going on, but nobody caught that. As many times as I had been to the doctor, wow. As many times that I had complained, and then some years later, I had a miscarriage, and I literally sat in the, actually it was around the same time, so about a year later I had a miscarriage, and I actually sat in the waiting room for 4 hours, to the point where I fell asleep and got up and left, because at this point it's over. And so after dealing with those things and my father's own personal experience, who just to backtrack, he was actually told that this was going to be covered. So after he has chemotherapy, in the end, the insurance company says, no, this is not going to be covered. So this just led me to the belief that there's a need out there, one, for education, and two, not only for the consumer, but two, for the providers. One, how do you engage your patients if they're saying this is hurting, or they're complaining about something and you're still going with the status quo, because you're the provider? How do you engage and connect with patients? And then of course, having a misdiagnosis is a quality issue. So that really fuels my passion for, or lack of diagnosis is a quality issue. So it really fuels my passion for what I'm doing, educating providers and getting to the root cause of issues.
Now, I can definitely understand a lot of people don't understand their insurance policies. People are told they need to have insurance, and they get the insurance, and then but they don't really understand what they are getting. Is HECA Healthcare Consulting also for the consumer out there that can call and just has general questions about their policy, or do you
Right.
strictly work with providers?
So we do work with providers, but we also have some health education initiatives. So, for example, we do workshops. We coming up in October, we're going to be sponsoring a health education fair. So we have the initiative side where we do go out and educate consumers about things that they need to know about the healthcare industry. So we just part of the business as a whole, we develop educational workshops. That is one of the things that we do. So that end is not specifically for providers. We can work with any kind of organization to develop those educational and training workshops.
Now, with healthcare in the news, every single day today, from just the provider's standpoint and the employees that are trying to do their jobs each and every day, I mean, do you see confusion and performance problems that are just related to the uncertainty in this whole industry?
Yeah, I think that a lot of it has to really do with the day-to-day stressors. There's this ongoing shortage in healthcare of trained providers, so people can easily suffer from burnout. There's the stigma, if I didn't document it, then it wasn't done. So if you make a mistake, some people don't feel comfortable documenting that mistake, and then what happens? It leads to bigger problems because they don't want to be at risk for losing their job. So there's that day-to-day stress. When you're talking about the debate regarding healthcare, you have low reimbursement rates, the constant regulations that providers have to meet. And so there's that strain. And also, I do want to point out that healthcare providers don't necessarily, if you're running a small practice, they don't necessarily get trained on the dynamics of running a business. So then there's that stress. A lot of healthcare providers, they go into private practice and they don't necessarily, and I'm talking about on a smaller scale here. Most of what I deal with, we do engage private practice providers as it relates to compliance and risk management, but most of our target is mid to larger size facilities. But just at the most, when you have a small provider who goes into business for himself, he may not know those dynamics. So just think about that. You're learning the process of operating a business, and you still having to deal with the issues of reimbursement, anything related to compliance. And right now, everything is so up in the air. Nobody knows what's going to happen.
How is the uncertainty affecting your business, or is it affecting your business in one capacity or another?
So right now it's not affecting me because, again, our goal is to really just engage with providers, and we're at the beginning of this process. So we're just telling people what we're about. Most of the clients that I've had at this point is related to content development because they want to engage patients on like website design. So we do a lot of different things, but as it relates to the training aspect of it, it's not necessarily affecting me because I think that a lot of people don't even know that we're here or what we do or what we're about. And that's the goal of participating in radio interviews like this. Some people just think that when it comes to healthcare training that they can buy these pre-developed training modules, but sometimes it's better to actually have a company like ours to come in and see what is going to be the most cost-effective way for you to invest and train your employees. I mean, if you think about all of these new regulations, for example, that they're going to be responsible for knowing, instead of actually trying to learn those yourself, we can bring in a compliance management solution for a smaller provider that would actually keep you updated and do self-auditing. So we offer a host of different things as it relates to that. And so our goal is to get to the root cause of any kind of training and performance issues. And sometimes people don't know that they are having those issues because a lot of times they try to address the issue with training, but it's just not cost effective.
Would you say healthcare is just one of those industries that is one of the more challenging in terms of regulation and coaching and consulting, a business, business owners, the management and the employees?
Yeah, it is, because you have to realize that healthcare has one of the most highly educated group of professionals. So sometimes what makes it difficult is the fact that you have people that have been in school for a long period of time, so they are the expert. But they are trained to do that specific job. It's not necessarily that they're trained on the business or dynamics of running the facility. So we have to first overcome that hurdles. If you think about it, sometimes a patient won't ask or challenge a doctor when it comes to a diagnosis, because they automatically assume that just because they're the doctor, right, that they know everything. You want to be able to trust and take their word for it. But this really requires a holistic perspective. It really takes a team to run a healthcare organization and engage. And sometimes it just takes a minute to really show people the value of having someone else who has objective perspective to come in and to assess your position and situation and provide you with feedback from an objective lens.
I talked with an IT solutions or IT managed services provider about 2 months ago, and all he did was IT solutions for the healthcare industry. And I was like, well, there's a lot of other businesses out there that need IT solutions, but he really went into it why the healthcare industry was so specific with the HIPAA regulations, and he designed a whole business around IT solutions just for healthcare.
And that's the same thing we're doing. We are offering a 360 performance approach, including training and lean management performance, just because healthcare, we have to we're dealing with a highly educated population here. We're dealing with high technical skill levels, and we're dealing with a lot of regulation. So there's going to be, some resistance to change. And I think probably even in that IT arena, there may even be some resistance as they try to implement EMR or electronic medical records, because some people, they're used to doing what they do. So it's a very broad landscape in this industry. And that's why it's so important to have an organization or company that can focus specifically on those key target areas.
No, I can definitely understand that. It's hard to teach an old dog new tricks. So when it comes to and it comes to medical records, that's a perfect analogy right there. Currently talking to Kristy Taylor, president of HECA Healthcare Consulting. Learn more at hecaconsulting.com. That's HEKA, hecaconsulting.com. We got more through when we come back from the break on That Business Show 2.0 with your host Jamie Maloney, where business becomes show business. We're back to That Business Show 2.0 with your host Jamie Maloney, where business becomes show business. New episodes weekday mornings 9 a.m. on thatbusinessnetwork.com, and we'd like to hear your story too. Simply visit tbsinterview.com for more information. Today, my guest is Kristy Taylor, president of HECA Healthcare Consulting. Learn more, hecaconsulting.com. And Kristy, to kind of carry over from that, last discussion, I was talking with an IT, managed services provider, about, him being just so niched inside healthcare for IT solutions. Talk to us more about why, a business such as yourself goes into that niche of healthcare and how you really understand that dynamic.
The reason why that we choose a specific niche and focus on healthcare is because there are hundreds of companies that do the type of work that we do as relates to training and development, that developing workshops. Again, we do offer a 360 approach. Primarily, we do engage with the providers, but we work with the organizations to develop those healthcare training workshops. The reason why this is so important is because if you think about it, if a healthcare organization wants to do lean management, the principles of lean management and Six Sigma are going to be the same. The principles of the IT solutions are going to be the same, but it's much more easier to navigate that process when you have people who have a background and experience, who really understand the regulations, the issues related to compliance. So one big advantage that my company offers is that we do have a background. My consultants, they have a background in healthcare. So the people that are to work on projects, they're going to be experienced healthcare professionals. And if I do bring in someone, for example, who may not necessarily have a degree in healthcare, but they will be someone who has worked on those types of projects before I, as even to be considered to be added to my team. That's really important because it just makes navigating when a person has questions, it just makes navigating the process so easy. So I can really understand why the person that you spoke with chose to focus solely on IT in healthcare, just because it's just so much involved in terms of knowledge that you have to know going into the process. It's more than just about the principles of it. You really need to be knowledgeable of the system.
Now you mentioned the 360, solutions. Take me through your services as you relate to healthcare.
Okay, so again, the root of anything that we do is going to focus on the training. We can come in and we can develop e-learning solutions. We have instructional designers. We can also source that talent. Some people don't really know that you can come to us, and if, let's say, you're working on a project and you need a project manager or you need instructional designers because you have subject matter experts on site and you just want to bring your vision to life, we can help you do that. But again, before we even go through the process of we're going to divide, manage this training solution for you, we actually will sit down with you, have a free consultation, and really at that point listen to what your needs are and try to have, do some type of performance consulting where we actually get to the root cause of it. And if we find that it's not necessarily training that you need, before we have you invest in something this expensive, we're going to go through a range of things. Is it, maybe you need to educate people about your products and services more. So we have website development, content development. Maybe you have an idea for, maybe you need this software to make things more efficient. We actually have software developers that can bring your vision to light. We have project managers, so we can manage your projects from end to end. So it's not just about the training piece. If you have a project that needs to be managed from end to end, we offer those project managers. We'll source that talent for you. And we'll go through the process of just making sure you stay informed. And really, again, it's all about bringing that vision to light. We are not going to necessarily tell you what to do. We believe that the consulting process is a collaborative process. We are your partners. We are here to support you. And our goal is really to give you a variety of options. The best example, again, I can offer you is with a small independent practice provider. So I may be approached by an independent practice provider, family medicine, for example, who wants to develop some type of HIPAA training or some type of training solutions, onboarding training for his staff. Now, before I do that, I'm going to sit down with this person. We're going to talk to them and really just hear what it is that he needs. Maybe they're actually having a issue with employees not really understanding the expectations or with compliance. So in that specific case, before I develop a plan worth, that could be very lucrative for me, thousands of dollars, I want to make sure that it's worth the investment for that provider. So what I would more than likely do, say in that instance, I would link this provider to a one of our partners who does compliance management, where they can actually have an LMS system, learning management system, and they can put copies of their policies, they can put copies of their training, and in that case, that they would receive information on the latest updates to laws. They would be able to do self audits, and then also they would have a third party who would come in and do auditing to make sure that they're in compliance. And so that would give them a complete system for a few $100s a month versus paying us thousands of dollars to develop something for them. I want what we do to be a benefit to the provider and to the patient, because ultimately it all trickles down to the quality of care that is going to be provided to patients.
Now, you are a award-winning professor, a PhD, author, speaker, a military veteran, 15 years in the healthcare industry. What's it like being an entrepreneur versus the other areas of life that you've been in? Is that the most challenging thing, or was it being in the military? Talk to me just on the personal level.
Well, I think, looking back, every experience that I've had actually, really plays into my entrepreneurial spirit now. Just a story that I shared with you earlier, that really has fueled my passion for working in healthcare. And I think that being able to work in an environment where I'm actually educating and empowering people and getting to the root cause of issues, naturally I bring that with me as a teacher. So a lot of my experiences actually play into what we do now. Now, has there been the ups and downs of learning how to really navigate this business and build it up? Yes, I believe that initially when I started, I said, okay, I'm going to have my first product out within 3 to 6 months. In terms of, we offer an academy and we're going to be offering trademark certification. So it was my goal to have that product out by January, I believe. But of course, deadlines come and go. And what you find in the process is that each experience is a learning experience. So maybe it was slow the first time. It has been slow. I think that one of the most shocking things was when I went to go file a trademark, and I thought that it would be instantaneous, and they said it would take 3 to 4 months.
3 or 4 months is
So,
actually pretty quick. They can take you a year or more sometimes. Yeah.
so learning that process, that's been the fun of it all. And I think that any piece of advice that I would give to any new entrepreneur is just hang in there. They say there's that statistic out there that says, within the first 3 to 5 years or so, a lot of new businesses fail, but you have to keep at it. And also be smart about your money and how you choose to invest in certain products and services. I do work with contractors a lot. I do a lot of stuff on my own. You're going to be your best marketing team. You're going to be the face of your company. And so, yes, I would say that every experience that I've had really has played and culminated to this moment that I'm in right now, or space that I'm in, to be able to get this company where it needs to be and position it. My goal is for us to be the #1 healthcare training and performance company in the United States and globally. That HECA Healthcare is a recognized brand in terms of being able to work with providers, offer the solutions that they need, or working with community organizations and listening and offering the solutions that they need to really, on the community organization end, to really engage clients and patients in their consumer education. On the provider end, to really make your healthcare organization to operate at peak efficiency and really cost efficiency. Because think about it, the more that we can engage healthcare providers to operate in a more cost-efficient manner, make sure that their staff is properly trained and educated about things, and to build those relationships with patients. We have to remember that we're going to be transitioning. We are transitioning more and more to a patient-centered approach. And what that means is that as a patient, I can go online, I can Google this doctor's name, and I can make a decision about the care that I want. And so if we can keep costs down, that eventually that trickles down to the patient. I mean, that is really what my goal behind this company is, after having my own experiences, just to really make it a better situation for patients by making it easier for providers to provide them with a one-stop shop that they can come to when they have needs in terms of training and performance improvement.
A couple minutes left. You have an ebook resource for people. Tell us about this.
So September 13th through the 15th, we're going to be having the Leadership Think Tank webinar. They can log on to hekaevents.com to register for that. And during that 3-day event, we're going to actually do webinars on building healthcare teams. The first day really just focuses on each day has a topic. So the first day is building teams and focusing on the future of healthcare. The second day focuses on training and development and performance. And the third day is going to be a lunch and learn, and it focuses on private practices. And I'm doing it in conjunction with my partners, Sonda Eunice of Leading Management Solutions, and Therese Swint of Equitable Med Solutions. And our goal is really to just, again, educate people about team dynamics. Now, when you attend that event, we're going to be releasing a free ebook along with that. It's called A Guide to Motivating Healthcare Teams Towards a Culture of Quality Improvement. It's just going to be a very short read. But again, we want to be able to provide people with some tools and tips on engaging leaders in the future of healthcare, and how to really push teams and gear to teams and create a culture that focuses on quality improvement and improving efficiency.
All right, good discussion, and thank you so much for being on the program today. Kristy Taylor, President of HECA Healthcare Consulting.
All right, thank you very much.
And again, learn more at HECAconsulting.com. That's HEKA, HECAconsulting.com. New episodes of our program each weekday morning, 9 a.m. on thatbusinessnetwork.com. And please connect with us all across social media, facebook.com/thatbusinessshow. Also, you'll find us on Twitter at thatbizshow. You've been listening to That Business Show 2.0 with your host, Jamie Maloney, where business becomes show business.